Hello, I am Dr. Joyce Lock, Medical Officer of Health at Southwestern Public Health.
And I'm Dr. Margaret Bertoldi, a pediatrician based in St. Thomas, Ontario. Today, we're answering common questions about the COVID-19 vaccine for children, especially those aged 5 to 11.
The vaccine is definitely safe. We know that because there is an extensive process to ensure that it's safe. Health Canada and the National Advisory Committee on Immunizations make recommendations for the use of vaccines in Canada. They ensure that the studies are well done to ensure safety and effectiveness. The size of the clinical trial group for this age group was at the upper end of what is considered standard. So that means that they looked at a lot of children before they came to their decisions. And in that group, that trial group, there were no serious side effects identified.
It's true, a lot of them get mild symptoms from COVID-19, but a lot of them also get quite sick. And I've seen a lot of very, very miserable kids with COVID-19. The other problem is that kids can experience what we call long haul COVID. And we don't have a lot of numbers on that, but some of the numbers coming out of the United Kingdom are showing numbers around 12% of kids who are experiencing long haul COVID symptoms that interfere with their everyday activities weeks to months after their initial illness. They are also more likely to experience what we call multi-system inflammatory disorders, even after just mild infections. And multi-system inflammatory disorders can actually be life-threatening.
Who, though they are mildly ill, do contribute to spread of the virus. And this leads to further disruption in the community, such as school closures, or they pass it on to their parents who take it on to work. So vaccination can help children get back to a more normal way of life, such as the ability to engage in sports and social activities and visit with extended family and friends again, because they're not at risk of passing the infection on to vulnerable people around them.
So COVID-19 infections have really been downplayed in children and in teens. But infections are risky, and some children and some teens have died. And to date, 17 people aged 17 and younger have died from COVID-19 in Canada. And I know that that is not a huge number, but as I mentioned earlier, when you get infected with COVID-19, you're also running the risk of getting long haul COVID, and you're also running the risk of getting the multi-system inflammatory conditions that we talked about a bit earlier. The other thing about natural immunity is that with COVID-19, because it's a coronavirus, the natural immunity varies and it's not all that long lasting. And some studies are showing that natural immunity wanes, which means it starts decreasing at approximately 3 months after infection. And we have seen cases where people have been infected with COVID once and they get reinfected with COVID again. So children who get in, as I said, they can get multi-system inflammatory syndrome. It's a condition where different body parts become inflamed, including their heart, their lungs, their kidneys, their brain, their skin, their eyes, and other organs. And that's often seen after a really mild infection with COVID-19. Vaccines offer a more predictable and more robust protection for children, even in those who have recovered from COVID-19.
Myocarditis and pericarditis are conditions that cause inflammation of and around the heart tissues. No cases were seen in the clinical trials of the pediatric formulation, even up to 3 months after vaccination. In some rare cases, some teens experience these conditions following receiving the adult formulation. Typically, the condition was mild and people responded well to treatment to make a full recovery.
Symptoms of myocarditis and pericarditis include chest pain, shortness of breath, and feeling a rapid or abnormal heartbeat. If your child or teen experiences these symptoms, you need to seek medical attention right away. The risk of these conditions is much higher and more severe from a COVID-19 infection than from the vaccination itself.
Since the initial authorization of COVID-19 vaccines in adult populations, Canadian and international studies have reviewed the impact of the longer intervals on ongoing protection levels against the virus. And data has shown that although you get very good protection from the manufacturer's label interval, that if you extend the interval to a longer interval to 8 weeks, then your immunity extends longer as well. So the current research shows an optimal immune response at about 8 weeks between the first and second dose for mRNA COVID-19 vaccines. There is also research that suggests these longer intervals may reduce the risk of myocarditis and pericarditis in youth. Research is ongoing, however, and so for now, we are going to adhere to the 8-week interval in our region.
No, it won't. So this vaccine is for the immune system. The reproductive system is a different system in the body. And the vaccine does not interfere with puberty. It doesn't interfere with hormones or with fertility. The active ingredient in the vaccines, the mRNA, is broken down very, very quickly after it enters the body. And it does not access you or your child's genetics or your DNA. Your DNA, in fact, your cell kind of looks like a fried egg, and in the middle, the yolk part of the fried egg, that's where your DNA is. And the mRNA doesn't get into that part of the cell. It stays in the outside part of the cell. So it doesn't get near your DNA. It also can't shed from your body to somebody else who's standing near you. The Society of Obstetricians and Gynecologists of Canada have refuted lots of online rumors stating that there's no evidence at all and no theoretical reason to suspect that this vaccine could impair male or female fertility. Those are rumors that are unfounded and they're quite harmful.
So in Canada, our consent laws allow for informed consent at any age, as long as the individual giving the vaccine obtains informed consent from the patient and the individual understands what they're consenting to. However, now as we roll out the vaccine for those under the age of 12, our health unit will require that the parent or the guardian gives consent at the time of their appointment. And this is a local health unit decision. So I hesitate to provide a conclusive response to this, as this would need to be evaluated on an ongoing basis against where cases are taking place at the local level. And the provincial and federal counterparts will also need to evaluate whether there is ongoing benefit for all of us from having a COVID-19 vaccine passport.
I would say no, don't wait. The virus is circulating locally. We have a lot of COVID-19 activity right now in our area, and there is definitely a risk of transmission. So I wouldn't delay vaccinating your 11-year-old. This is one of the few things in pediatrics that is administered by age rather than by height or weight. And the size of the dose doesn't seem to have a significant impact on the effectiveness of the vaccine. If you consider adults, I think of my brother, who's about 6'2" and 260 pounds. And then I think about my aunt, who's, 5'1" and 110 pounds on a good day. They both got the same dose of vaccine and it was effective for both of them. So if your 11-year-old child gets a pediatric dose now and they turn 12 before they get their second dose, then they'll get an adult dose for their second shot.
It's fastest and easiest to book online at covidvaccinelm.ca. Otherwise, call 1-800-922-0096, extension 9. Phone lines are very busy, so please stay patient. If you are booking more than one appointment the same day, the vaccine team at our clinics will do their best to group the appointments together.
Some primary care providers are also offering appointments for this age group. Your primary care provider will let you know if they do, or you can visit their websites or call their offices to ask.
We know this is an important decision and that you may want more information to decide to be vaccinated. Visit our website at www.swpublichealth.ca to learn more about the vaccine for children.
And for all of our kids out there, you guys have done such a great job so far during the pandemic, and you've done your learning at home and you haven't seen your friends and you haven't been able to do a lot of your play dates and your sports and your activities for quite a while. And you have been superheroes. And now it's your turn to get your shots to help everybody stay safe.